Your body can whisper a warning before it destroys your brain, and most people ignore it because the symptoms disappear. What feels harmless for minutes could be the countdown to a life-ending stroke within 48 hours. Welcome to Wellness Unfolds, where we explore the hidden signals your body sends before a major health crisis strikes you down. Today, we discuss the transient ischemic attack, often called a mini-stroke, a silent warning shot that demands your immediate attention now. A mini-stroke occurs when blood flow to part of the brain is blocked for a short time, causing temporary but dangerous dysfunction. Think of it as the tip of an iceberg. The symptoms might fade quickly, but the danger lurking beneath is absolutely massive. Medical statistics show that a massive stroke often follows a mini-stroke within just 48 hours, making immediate action a matter of survival. Even if you feel completely normal after a few minutes, your brain may have suffered permanent damage that requires urgent medical assessment. Many people dismiss these signs as simple fatigue or aging, but ignoring them is a gamble you really cannot afford to take. Every second that your brain is deprived of oxygen-rich blood, millions of neurons die, leading to irreversible loss of function. We have compiled a list of 20 silent symptoms that are frequently overlooked, helping you identify the danger before it strikes hard. Let us begin with the first category of physical warning signs, which are often subtle enough to be missed during daily activities. Sudden numbness or weakness in the face is a classic sign, often feeling like a dental injection that has not worn off. You might try to smile in the mirror and notice that one side of your mouth droops down, refusing to lift up. Arm weakness is another major red flag, where one arm feels incredibly heavy or simply cannot be lifted to shoulder height. This weakness usually affects just one side of the body, making simple tasks like buttoning a shirt or holding a fork impossible. Leg weakness can strike without warning, causing you to stumble or feel like your leg has suddenly turned to soft jelly. It is not just clumsiness, it is a neurological failure where your brain cannot send the proper signals to your leg muscles. Pay close attention to symptom number 4, brief periods of zoning out or lost consciousness, often mistaken for simple daydreaming or aging. Family members might think you are just ignoring them, but this momentary absence is a critical sign of interrupted brain blood flow. This zoning out is actually a seizure-like event or a direct result of the brainstem not receiving enough vital oxygen. Do not let anyone tell you this is normal aging. It requires an immediate neurological evaluation to prevent a catastrophic event later. Slurred speech or dysarthria happens when the muscles used for speech become weak or paralyzed, making your words sound incredibly drunk. You might know exactly what you want to say, but your mouth simply refuses to form the shapes needed for the words. Aphasia is different from slurring. It is the inability to find the right words or understanding what others are saying to you. It feels like the library of words in your brain has been locked, leaving you unable to communicate your basic needs. Receptive aphasia means you can hear the sound of voices, but your brain can no longer decode the meaning behind them. Sudden loss of balance or coordination, often called ataxia, can make you feel like you are walking on a moving boat. This is not just dizziness, it is a disconnect between your brain's balance center and your body, leading to dangerous falls. Vertigo is the sensation that the room is spinning around you, often accompanied by nausea and an inability to stand upright. Unlike regular dizziness, this sensation is intense, sudden, and does not improve by simply sitting down or drinking some water. A thunderclap headache is a severe headache that comes on within seconds, often described as the worst pain of your life. This is not a migraine. It is a potential sign of bleeding or blockage in the brain that needs emergency scanning. Sudden blurred vision in one or both eyes is a common warning sign that the stroke is affecting the visual cortex. You might think your glasses are dirty, but this blurriness comes from within the brain and cannot be fixed by lenses. Amaurosis fugax is a condition where vision in one eye goes dark, like a curtain being pulled down over your view. This specific symptom strongly suggests a clot in the carotid artery, which is a direct highway to your brain and eyes. Double vision can occur suddenly, making it dangerous to walk or drive, as you cannot judge distances or positions accurately. This happens when the brainstem is affected, disrupting the coordination between your two eyes and causing visual chaos. Dysphagia, or difficulty swallowing, is a frightening symptom where the muscles in your throat fail to respond to your brain's commands. This can lead to choking or aspiration pneumonia, and it indicates that the stroke is affecting the brainstem's vital functions. A sudden tingling sensation, often described as pins and needles, can affect one side of your body without any external cause. This paresthesia is a sensory warning that the parts of your brain responsible for feeling touch are being starved of oxygen. Sudden confusion or memory loss can strike, leaving you unable to remember where you are or what you were just doing. This is not dementia setting in slowly. It is an acute failure of the brain's memory circuits due to blood flow restriction. Sudden changes in personality or mood, such as unprovoked aggression or apathy, can signal a frontal lobe ischemic attack. If a loved one acts strangely out of character instantly, consider it a medical emergency rather than just a bad mood. Uncontrollable hiccups, especially when combined with nausea or chest pain, can surprisingly be a sign of a stroke in the brainstem. Most people ignore hiccups, but when they are persistent and sudden along with other symptoms, they are a serious red flag. Sudden trouble breathing, or a change in breathing pattern without physical exertion, can indicate the brain's respiratory center is struggling. This symptom is often mistaken for a panic attack or heart issue, but it can stem directly from a neurological blockage. Sudden, unexplained fatigue that feels like a total system shutdown is the final silent symptom that women especially should watch for. This is not just needing a nap. It is your body reacting to a significant neurological event that requires immediate medical care. Now that you know the 20 silent signs, we must discuss the critical timeline that determines life or death after TIA. The risk of a major stroke is highest within the first 48 hours, but remains dangerously elevated for up to 3 months. This is why you cannot wait to see if you feel better tomorrow. Tomorrow might be too late to save your brain. To remember the most common signs and the correct action, medical professionals worldwide use the acronym FAST: face, arms, speech, time. F stands for face. Ask the person to smile. Does one side of the face droop? This is your first clue. A stands for arms. Ask the person to raise both arms. Does one arm drift downward? Note any weakness or instability. S stands for speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? Can they understand you? T stands for time. If you see any of these signs, call emergency services immediately. Note the time the symptoms started. Time is brain. There is a narrow window for doctors to administer clot-busting drugs that can reverse the damage completely. Never drive yourself to the hospital. Symptoms can return or worsen instantly, making you a danger to yourself and others on the road. Ambulance staff can begin life-saving treatment on the way and alert the hospital to prepare for your arrival immediately. Do not take aspirin unless the emergency dispatcher tells you to, as some strokes are caused by bleeding, not clots. Prevention is your best defense. Managing high blood pressure is the single most important step you can take to prevent TIA. Adopt a diet rich in fruits, vegetables, and healthy fats, while reducing sodium to keep your arteries clean and flexible. Regular physical activity helps maintain a healthy weight and lowers cholesterol, significantly reducing the likelihood of clot formation. If you smoke, quitting is the most powerful immediate change you can make to improve your vascular health and survival odds. Diabetes doubles your risk of stroke, so keeping your blood sugar within a healthy range is absolutely critical for protection. Treating sleep apnea and ensuring quality rest allows your brain to recover and regulates blood pressure during the night. A mini-stroke is a gift in disguise. It is a warning that allows you to change your path before disaster strikes. By recognizing these 20 symptoms and acting fast, you are not just saving your health, you are saving your life. Your health is your most valuable asset, and protecting it ensures you can enjoy many more precious moments with loved ones. Please share this video with your friends and family. You never know whose life you might save with this information. Thank you for watching Wellness Unfolds. Stay vigilant, listen to your body, and prioritize your wellness every single day. Don't forget to subscribe for more life-saving health insights. We will see you in the next video. Stay healthy. Let us dig deeper into the biology. Most TIAs are caused by microscopic clots that travel from the heart or neck. Atherosclerosis, or hardening of the arteries, creates a rough surface where these dangerous clots can easily form and break loose. Atrial fibrillation is a leading cause, where the heart quivers instead of beating, allowing clots to form and travel upward. When that clot lodges in a brain vessel, the specific function controlled by that area shuts down instantly, causing symptoms. In a TIA, Your body's natural defense system dissolves the clot quickly, restoring flow before massive cell death occurs. However, relying on this natural process is dangerous because you never know if the clot will dissolve or stay permanently. The symptoms you experience depend entirely on where the clot lands. A clot in the back affects vision and balance. If the clot hits the left hemisphere, you are more likely to experience speech problems and right-sided body weakness. A blockage in the motor cortex disconnects the brain from the muscles, leading to the paralysis we discussed earlier. Doctors call the first few hours the golden window. Reaching the hospital within this time maximizes your chance of full recovery. Upon arrival, a CT scan will immediately determine if you are having a stroke and what type it is. Doctors will also check your blood sugar, cholesterol, and heart rhythm to find the source of the clot. A carotid ultrasound is often performed to see if the main arteries feeding your brain are narrowed by dangerous plaque. You may be prescribed blood thinners or cholesterol medication to prevent new clots from forming and traveling to the brain. In severe cases, surgery may be needed to clean out the carotid artery and restore safe blood flow to the brain. Adhering to your medication schedule is non-negotiable. Skipping doses opens the door for a massive stroke to occur. While we cannot change our age or family history, understanding these risks helps us be more vigilant about the factors we control. Sedentary lifestyle is a major killer. Your blood needs movement to flow freely and prevent stagnation and clotting. Chronic stress spikes your blood pressure and cortisol levels, damaging blood vessels over time and increasing stroke risk. Incorporating relaxation techniques like deep breathing or meditation can actively lower your blood pressure and protect your brain. Excessive alcohol consumption raises blood pressure and can trigger irregular heartbeats, so moderation is key for stroke prevention. Maintaining a healthy weight reduces the strain on your heart and circulatory system, lowering the risk of clot formation. The Mediterranean diet is scientifically proven to support brain health, reducing inflammation, and keeping blood vessels clear. Dehydration thickens your blood, making it easier to clot. Drink plenty of water throughout the day to stay safe. Regular checkups allow your doctor to spot silent killers like high blood pressure before they cause a TIA. Many people survive TIA and go on to live long, healthy lives because they took the warning seriously and acted. Remember symptom number 4. If you or a loved one zones out unexpectedly, do not assume it is just old age. Unlike fainting where you fall, a TIA zone out might happen while sitting, making it harder to notice but equally dangerous. Often, the patient is unaware of what happened. It is up to family and friends to notice the lapse. Keep a record of any strange events. Write down the time, duration, and specific symptoms to help the doctors. Modern smartwatches can detect atrial fibrillation. If your watch alerts you to an irregular rhythm, see a doctor immediately. Set up your medical ID on your phone so emergency responders can access your history if you cannot speak. Teach the FAST rule to everyone in your household, including children. They might be the only ones around to help. Do not worry about making a fuss or a false alarm. It is always better to be checked and cleared. Women often experience non-traditional symptoms like nausea, general weakness, or chest pain, leading to delayed diagnosis and treatment. Men often try to tough it out or sleep it off. This stubbornness can be a fatal mistake with TIA. Experiencing a TIA can cause anxiety and fear of a future stroke. Mental health support is an important part of recovery. Joining a support group can help you connect with others who understand your journey and share valuable coping strategies. If you have lingering minor symptoms, occupational or physical therapy can help retrain your brain and restore full function. After a TIA, your body needs rest. Do not rush back to high-stress activities immediately. Give your brain time to heal. Understand your cholesterol numbers. Lowering bad LDL cholesterol is essential to prevent the plaque buildup that causes clots. Keep your brain active with puzzles, reading, or learning new skills to build cognitive reserve and improve neural health. Avoid secondhand smoke as well. Breathing in smoke damages your blood vessels just as much as smoking yourself. Reduce salt intake to manage blood pressure. Flavor your food with herbs and spices instead of relying on sodium. Weigh yourself weekly to ensure you are maintaining a healthy range. Sudden weight gain can put stress on your heart. Surprisingly, gum disease is linked to heart disease. Good oral hygiene can actually help protect your arteries from inflammation. Get your annual flu shot. Infections cause inflammation in the body, which can temporarily increase the risk of clot formation. Know your body mass index. It is a useful tool to estimate if your weight is putting you at risk. Gentle exercises like yoga or Tai Chi improve balance and lower blood pressure without putting too much strain on the body. Set alarms on your phone to ensure you never miss a dose of your blood pressure or blood thinning medication. Never stop taking your medication just because you feel good. That means the medicine is working, not that you are cured. When traveling, always carry a list of your medications and medical history in case you need emergency care away from home. Learn to check your own pulse. If it feels irregular or chaotic, it could be a sign of atrial fibrillation. Avoid extreme temperature shocks, like jumping into very cold water, which can spike blood pressure and trigger a vascular event. Cold weather constricts blood vessels. Dress warmly in winter to prevent unnecessary spikes in blood pressure when you go outside. If you are sensitive to caffeine, limit your intake as it can raise blood pressure and trigger heart palpitations. Women should discuss the risks of hormonal birth control or replacement therapy with their doctor, as these can increase clot risk. Stay socially connected. Isolation and loneliness are linked to higher rates of heart disease and stroke in elderly adults. Owning a pet has been shown to lower blood pressure and reduce stress, providing a protective benefit for your heart. Laughter really is good medicine. It relaxes your blood vessels and improves blood flow for up to 45 minutes. Practicing gratitude can lower stress hormones. Taking time to appreciate life helps keep your heart and brain healthy. Let us recap the most critical point. Remember FAST. Face, arms, speech, time. Memorize this and teach it to others. Keep the list of 20 silent symptoms in mind. Being able to spot the subtle signs is your superpower. Your body speaks to you. Do not silence it with denial. Listen to the whispers so you don't have to hear the scream. If you ever feel something is wrong, go to the hospital. It is better to waste an afternoon than lose a life. Together, we can build a world where strokes are prevented, not just treated. It starts with awareness and action. We also want to thank the incredible medical professionals who work tirelessly every day to save lives from stroke. Do you have a personal experience with TIA? Share your story in the comments below to help inspire and educate others. Please remember this video is for educational purposes only and does not replace professional medical advice, diagnosis, or treatment. Life is beautiful and fragile. Protect it with knowledge, nourish it with healthy choices, and cherish every moment you have. At Wellness Unfolds, we are committed to bringing you the most important health information to empower your journey to wellness. If you found this video helpful, please hit the like button and subscribe. It helps us reach more people and save lives. Check out our other videos on heart health and nutrition to continue building your knowledge base for a healthier future. Take care of yourself and your loved ones. We look forward to seeing you again very soon in our next upload. Thank you for watching Wellness Unfolds. Please subscribe, share this vital information, and stay healthy until we meet again next time.